Hello guys, today we are going to know about insulin and how this insulin work in our body. Insulin is generally a hormone that helps regulate blood sugar level or blood glucose level in our body. Insulin acts as a receptor or a path through which glucose moves from the blood and get into different cells throughout our body. And by this, the cells use this glucose that gives us energy. So, when we eat food, the body breaks down food into sugar or glucose. That glucose enters our bloodstream and results in high blood sugar. So, basically, if this high blood sugar persists, it will result as diabetes or diabetes mellitus. So, our body, need to lower this blood sugar level, for which there is insulin. So the raised blood sugar will promote insulin release from pancreas. The insulin then acts as a receptor or a key to open cells. And when the cells open, it will allow glucose to enter into different cells of the body like muscles, liver, and fat cells. So basically, insulin stimulates glucose uptake from blood by cells, which makes the blood glucose level return to normal level. The liver also stores any extra glucose in the form of glycogen, and then it will be used for energy in emergency conditions when our body will be in need of instant energy, like when we exercise. The glycogen makes glucose for energy. So, this is how insulin acts and works in our body. If we talk about blood sugar levels, then the normal blood sugar levels are measured as RBS or random blood sugar, which should be less than 140 mg per deciliter. Fasting blood sugar or FBS means in empty stomach or before meal, your blood sugar level should be between 65 to 100. Postprandial or PPBS means after 2 hours of eating food, the sugar level should be around 70 to 140 mg per deciliter. And HbA1c level should be less than 5.6%. So these are the normal parameters. Any deviation to the test found to be higher than normal range, it will be called as high sugar or diabetic condition. So our blood sugar level must be within normal ranges that are explained here. There are two types of diabetes mainly, type 1 and type 2 diabetes. Other types are also there like type 3 and type 4 diabetes, but the almost all diabetic people will come under these two types, type 1 and type 2. So what are these two types tells us about? Type 1 diabetes is mainly due to autoimmune causes. Your pancreas has no insulin to produce. So you need insulin from outside. You need insulin injections for lifelong. So it can be also called as insulin dependent for life or insulin dependent diabetes mellitus. So its treatment is only insulin therapy. Talking about type 2 diabetes, it is mainly due to your own lifestyle. The problem lies in your body, or your pancreas produces very few insulin, or your body becomes insulin resistant. So everything is mainly due to your food, diet, lifestyle. So it comes under type 2 diabetes. So it is known as non-insulin dependent diabetes mellitus. Its treatment is basically lies in your diet, lifestyle modification, oral hypoglycemic agents or anti-diabetic drugs, or if needed, insulin therapy can be given. So this is the difference between type 1 and type 2 diabetes. In type 1, you will have no insulin. In type 2, there will be some insulin, but the problem lies in your diet and lifestyle. So now let's talk about insulin therapy. Route of administration of insulin is either intravenous or intramuscular or subcutaneous. And site of injections are mainly posterior aspects of your upper arm, that means deltoid muscle. Next is anterolateral aspects of your thigh, anterolateral aspects of buttocks or your abdominal fat. So this is how insulin should be injected, and dose of insulin will be depend upon your level of raised glucose. There are total four types of insulin. First one is rapid acting insulin. That means the onset of action will be early, as soon as possible. Types are insulin lispro, insulin aspart, insulin glucagon. So these are three types of rapid acting insulin. Its action starts in between in about 15 minutes, and the duration of action it can hold for 3 to 5 hours. So after injecting the insulin, after injection, within 15 minutes the action will be starts. It is advised to eat a meal within 15 minutes of insulin injection. Otherwise, it can cause hypoglycemia. The blood sugar level of your body will be fall beyond 70 mg per deciliter. So you must eat a meal within 15 minutes of rapid acting insulin administration. Next, we have short-acting insulin types. So its onset of action will be little late, about 30 minutes to 1 hour, and can be effective for 6 to 8 hours. The name is regular insulin. Regular insulin is a short-acting insulin and it is mostly used insulin drug. Most commonly it is used and it is the only IV drug, only intravenous drug that is being used. And it can be mixed with other insulin types for better effects. So most commonly regular insulin is used nowadays and everywhere it is used. Intermediate acting insulin, that is NPH or isofen. Its action starts in 1 to 2 hours and can be for 10 to 20 hours. The fourth type of insulin is long-acting insulin. So we have three long-acting preparations: insulin glargine, insulin detamir, and insulin degludec. The duration of its action is for 20 to 40 hours. That means, though after injecting the insulin, the effect will be for 20 to 40 hours. But with minimal peak effects. Since these are long-acting, it is advised to never mix this insulin preparation with other insulin types. So this long-acting insulin can be mixed with other type of like short-acting or rapid-acting insulin. To avoid severe hypoglycemia and other adverse effect, so it is advised not to mix with other type of insulin. Insulin degludec is the ultra long-acting drug here. So we know about the different types of insulin, different preparations, different actions, durations. So what are the indications of insulin therapy? When to use? The mainstay indication is type 1 diabetes, where there will be no insulin, so you must need the insulin therapy for the treatment. In unresponsive type 2 diabetes, where the high sugar is an unresponsive to oral hypoglycemic drug. In type 2, the main treatment is oral hypoglycemia or anti-diabetic drug. But if it is unresponsive to drugs, then you can give insulin therapy. Next, in conditions like diabetic ketoacidosis or DKA. Hyperosmolar hyperglycemic syndrome, where the blood sugar level becomes more than 500 mg per deciliter, which can be fatal and an emergency condition. In that condition also insulin therapy can be used. And in gestational diabetes or diabetes during pregnancy. So these are some of the conditions where insulin is mainly used. We know everything about insulin, but the main goal of insulin therapy is to maintain the fasting blood sugar level, that is in between 90 to 120 mg per deciliter. It should be fall less than 120 level, and for postprandial it is below 150 mg per deciliter. So the main mechanism of insulin is to lower the blood sugar level. For fasting, the blood sugar level should be dropped to 90 to 120, and the postprandial blood sugar should be less than 120 or 150. So if you maintain the sugar level in these levels, the controlled blood sugar level will help your body to grow healthy. No further complications of diabetes will not occur. If you use insulin therapy with oral hypoglycemia agents or anti-diabetic drugs, so it is mainly to control the blood HbA1c level to below 5.6%. So all you need to is to control your blood sugar level to a limit and make yourself diabetic free. So if you use insulin therapy for a long time or in high dose or misuse the usage, what will be the adverse effect of the insulin therapy that can be caused? First is hypoglycemia, which can be fatal and make your body weak and unresponsive. So hypoglycemia is the most common adverse effect of insulin therapy. Next is weight gain. You will gain weight at the injection site. Local allergic reactions can be seen, lipoatrophy or lipohypertrophy, which mainly results in weight gain. On prolonged use of insulin, hypokalemia can be occurred. Your potassium level will fall and can result into muscle weakness, fatigue, cramps, and other systemic problems. These are some features of hypokalemia. And lastly, it can cause insulin resistance or antibody formation. Due to prolonged use, there will be insulin resistance, which in case of emergency, the action of insulin therapy will be ineffective. That's why if you are using insulin therapy, if you are taking insulin, then you should be cautious. So these are all about insulin types, uses, action, when to use, and how to use, and the adverse effect of insulin uses. That's all for today, guys. Keep watching our videos. Thank you. Thank you for watching.